My plan in life was either to be a professional soccer player or become a doctor. And got injured when I was 21, 22, so had to stop playing, had a couple surgeries, and I had my share of orthopedic surgeries done to myself, a couple ankle surgeries, knees, elbow. So I figured it only made sense that I became an orthopedic surgeon, and then my love was sports. I was like, well, it only makes sense to become a sports doc. So, well, I think my background as an athlete helped my career from a professional medical standpoint. I was able to train with Dr. Andrews, James Andrews, who's the most famous sports surgeon in the world, and he gets hundreds and hundreds of applicants a year. And I think my sports background, full scholarship Notre Dame, U.S. national team, playing professionally in Italy, definitely caught his eye enough to him accepting me to take part in his fellowship. So I think from that standpoint, that's probably the biggest influence on my career. The role of the team physician, I think the most important role of the team physician is do what's best for the athlete. And what that means is there's so many other things going on: agent contracts, coach's desires, parents' desires. I mean, a lot of time the only real medical knowledgeable person out there is the doctor, and he needs to do what's best for his patient, who is the player. First of all, I think the definition of athlete is not just the college level athlete or the professional athlete with a contract. I think anybody that's active, normal than just sitting at a desk from 8 to 5, and they're an athlete in their sense. So the weekend warrior, absolutely. People that just go jogging, occasional 5K, or play pickup for fun. I mean, they're all athletes, but in their own sense. So, and they all have their little injuries, and I see all that, and that's, at the end of the day, the majority of my practice is that stuff. I was trained heavily in anything orthopedic, so I train at level 1 trauma centers. I do a lot of trauma. Any sort of joint preservation to even replacement if needed. And then from my sports background, arthroscopy, minimally invasive, I tell people jokingly that I can stick a scope in any joint. But that's kind of my background, my forte. But again, the term athlete kind of is all-encompassing, more than just walking around, you're an athlete in my book.